Hello, it is another exciting edition of the program Health Affair on AIT, a program where we discuss critical health issues with a view to finding lasting solutions. I am your host, Oshuomowa Daniels, and you are welcome. Have you ever wondered why you take medicines to cure an ailment and it does not work? Do you know that the medicines you take to get relief from pain or to cure an ailment can become poisonous and damage one's organs? Find out this and many more on today's edition of the program. But before then, let's take you to our news segment for some reports. That hymn, Immortal, Invisible God, was carefully chosen to set the tone for the day's event. With the theme, Deeply Rooted, Staying Alive, women in the face of challenging storms, like the COVID-19 pandemic that killed about 1.3 million people across the globe, and the recent EndSARS protest that shook Nigeria to its foundation, were challenged to stand collectively and as individuals in the gap.
Be deeply rooted, have a vision, be focused, keep going, keep moving in the right direction. Don't go backwards again. We want to be a nation in 10 years, in 20 years, just like the United Nations Sustainable Development Goals. We want to have a goal for greater development and the courage to pursue the vision.
Rooted in Christ, deeply rooted in the Word of God, deeply rooted in love, and deeply rooted in thankfulness. Because certain grace come upon your life when you are deeply rooted in those four things.
Do not let what you see take away what you know. When you know, you are relaxed. You know that whatever is going on, as a child of God, the covenant is your cover.
Convener Dr. Iluyomade called for an end to the increasing cases of rape in Nigeria.
When you teach a boy child that the woman is meant to be looked after, to be protected, and you are the protector, we don't teach enough. So the rape of minors is an abomination. The rape not even of minors, the rape of anybody. I am a lawyer. You cannot rape anybody and only have any form of intercourse with that person with their consent. It just is not acceptable. And for us to say it is rampant, it is okay, it's not okay. There are guidelines. There are things we need to put in. Children should not be out of school. Children should be in school. When school is over, there should be a community environment where they go to learn, after school community environment. That will safeguard at least most of our children. It may not completely eradicate it. Then we talk about the trauma of rape. If you have been raped, it just doesn't go away. Just like some people say poverty doesn't go away. But poverty can go away with riches. But then there's a psychological pain that may never go away. It is unacceptable. And then having those young children get pregnant, it is a shame.
With a vision for healthy living, she used the opportunity to celebrate the frontline workers in Lagos and Ogun State who worked tirelessly to control the pandemic.
Aki Abayomi, the Commissioner for Health, Lagos State, the Arise Ambassador Hour. Keep doing what you do. Nigeria has a good future with more round pegs in round holes.
Thank you very much, and I'd like to accept this award in recognition of all the frontline workers in Lagos, the doctors, the nurses, community health extension workers,
laboratory scientists, volunteers who put their lives on the line to protect all Lagosians during this COVID pandemic. We deeply appreciate your selfless work.
A point of the event was the launch of COVID-19 palliatives in all local government areas of Lagos State.
On behalf of the convener, our mother, Pastor Dr. Mrs. Iluyomade, I commissioned this palliative glory of God, in the name of God the Father, God the Son, and God the Holy Spirit.
Arise Women Conference is an annual event preceded by the Arise Work for Life. For 12 years, Arise has impacted thousands of women without discrimination in areas of healthcare delivery, education, and capacity building.
The Lagos State Commissioner for Health, Professor Akin Abayomi, has appealed to residents to keep observing the COVID-19 preventive guidelines to avert a second wave of the pandemic in Nigeria. The commissioner, who spoke with AIT at the 2020 Arise Women Conference in Lagos, said 50 to 100 cases are recorded on a daily basis out of 1,500 persons tested.
Well, I think it's important to remember that COVID is a global pandemic. It's not over by any stretch of the imagination. It's Many countries around the world are going through a second and a third wave, and we shouldn't relax our guard. We saw the impact of the first wave in Nigeria and in Africa. We don't know what's going to happen next, but it would be irresponsible of us to drop our guard and allow the opportunity for a second wave. So the message to Nigerians is, please watch the global arena. Many countries are going through an even more powerful second wave. We don't want to go through the same thing in Nigeria, and certainly not in Lagos, because the consequences of a second wave is again a lockdown and, spending resources on isolation and awareness and all those kinds of things. We don't want a situation where it impacts our economy again, because that just brings in, lots of suffering to the people. So if we maintain our observation of social distancing, hygiene, and just precaution, I think we may be able to prevent the country from going into a second wave.
I do not believe any conspiracy theory that the coronavirus is over exaggerated in Nigeria and is used by the government to make money.
Coronavirus has no cure, so prevention is better. Coronavirus is real. Wash your hands all the time.
Together, we can fight coronavirus.
COVID-19 is disrupting the pharmaceutical industry, causing drug shortages around the world and exposing the need for more resilient global supply chain. To help import-dependent countries like Nigeria survive this challenge, digital technology, experts say, is key. This has necessitated the theme for the 2020 Omoluabi Conference, Technological Revolution, Adaptation in Pharmaceutical Manufacturing, Pharmacy Practice and Regulation, holding in Osogbo, Osun State, Nigeria.
Scientists around the world and a researcher in Iran are working to enlist dogs in the fight against COVID-19 pandemic. With this development, one who is concerned about mild COVID-19 symptoms, instead of being greeted by a nurse wielding a nasal swab, a look into the face of a gentle German Shepherd for a sniff inspection gets results. The use of trained dogs to detect the coronavirus, according to a recent newspaper publication, even though sounds funny, is already happening. Some Finnish researchers were reported to have launched a pilot study involving 4 COVID-19 dogs at Helsinki airport. Arriving international passengers were asked to rub their skin with special wipes, which was then placed in a beaker next to the other containers of different control scents. With a few sniffs, the dogs were able to identify infected passengers.
Welcome back. The word drug abuse is not new to many people, but what is not clear is the difference between drug abuse, drug misuse, and overdose, and how these factors impact on the health of people, how they can reduce the potency of medicines, and lots more. We have on the show today the president of the Pharmaceutical Society of Nigeria, Mazi Ohwabua, to tell us what we need to know about today's topic.
What differentiates self-medication from drug abuse I will talk about all the time. Well, first is that health is an individual person's responsibility. Your health is primarily your own responsibility, not anybody's. It is a recognition of that self-medication is allowed all over the world, because you are the man who is whose health is. However, it is allowed within some constraints. It's just the same thing as saying you have freedom to live your life, but you are not free to kill yourself. So it's the same with self-medication is allowed, but we're not allowed you to poison yourself. And that's why then the other reason why self-medication is allowed is that there are not enough doctors, there are not enough health professionals, there are not enough pharmacists or nurses to take care of everybody's health at every level. I mean, if we said everybody, before you take a medicine for headache, see a doctor, there'll be a queue. For 1 week, some people have still not seen a doctor anywhere. It's not Nigeria alone, no, but it's worse in our country where you have a very low doctor individual or pharmacist individual or nursing. Healthcare per capita is low. So that will even take weeks. And the person may have either been killed by the headache or by the malaria or by the diarrhea or something. So that's why. That's the second reason. I'll give you the first one as a human right. Number two is to be able to ensure that given the constraints of healthcare personnel, we don't ask people to suffer unduly until they see a medical personnel. And if you see that for products that are allowed for you to use for self-medication, there's always a caveat. It says if you do not get a relief after 2 days, go and see your doctor. Okay? So if you take self-medication and after 2 days or you do not see, then you need to go and see a healthcare professional.
We'd like to know the difference between self-medication, drug misuse, and then drug abuse.
Anybody that uses a self-prescribed medicine for more than 2-3 days is now misusing medicine. Misuse. There's a difference. I wanted to show you the difference. There's called misuse. There's drug self-medication, drug misuse, and drug abuse. There are three things. Drug misuse is when you now use it beyond allowed time, is misuse. When you haven't gotten a proper recommendation, you are allowed to use analgesic, but you're not allowed to use antibiotic. Antibiotic must be by prescription. If you prescribe it for yourself, it's misuse, right ab initio, because you are already you're not sure. You're not using it for, there's no certainty that what you're using it is right. It's misuse. Drug abuse in itself is you're now using the drug no longer for its therapeutic purposes, but for the side benefits. And that's why drugs that are subject to abuse are drugs that called central drugs that work in the central nervous system. People, they're stressed, they go and buy Valium or Lexotan on their own. That is abuse. They're using it now, not just they're stressed, but they want to sleep. Some go and buy codeine. They want to feel high. Then they go down to other narcotic products. Self-medication, you are allowed a given number of days for it, just to treat symptoms. If the symptoms persist, you now go and see your health. Instead of going to see your health consultant, you continue to use that medication, you are now misusing the drug. Or they ask, take this drug for 5 days, you take it for 7 days, it's misuse. Somebody else has been treated by a drug, it tells you, you go and buy it, it's misuse.
What is the implication of drug abuse, drug misuse, and self-medication?
The implication of drug misuse is that you poison yourself. Because when a doctor says, or a pharmacist says, use a medicine for 5 days, it came from clinical trials that after 5 days, because when you take a medicine, so many things happen. First, that the medicine, let's take an antibiotic. Antibiotic kills organisms that are offended. and also kill organisms that are supportive. You know, there are some organisms that help us. Are you aware? There are some organisms, microorganisms that live in our gut. If you take them away completely, you have crisis. They're there. God has allowed them to exist. But it's when the balance becomes that you have issues, diarrhea, dysentery. But okay. So if you go beyond that, you might go beyond what's intended. Two, certain things kill cells. You know, the organisms that are found in your body are cells. Every living organism has cells. The human being has cells. So if you go beyond a particular dose or frequency or length of therapy, the thing will not only kill the organism, start killing your own cell. Because your cell is a cell. It's also the cell of a living organism. So you start destroying your own cells. You start getting cell necrosis. As from cell necrosis can lead to organ damage. Drug abuse. The side effect of drug abuse is that you can get dependence. So you're dependent, you can't sleep without venom. You can't be at ease until you're taking codeine, until you're taking cannabis. You can't enjoy life until you're taking cannabis. You can't have sex until you're taking something. You know, you become dependent. A drug is a poison, potential poison. It's metabolized. When you take a drug, after the given number of hours, it enters your blood system, goes to do the work, then through the blood circulation, it goes to the liver. The liver now detoxifies it. The liver is the chemical plant where it takes a poison and takes away the poisonous things from it. After the work, the drug has done its work. The drug breaks down, producing certain things. So the liver takes them away. They pass some through your urine out, put back through your feces, exit them from your body so that you are not poisoned by those things. But the liver can be overwhelmed by the size of what you're drinking. The liver can be overwhelmed by the incipient necrosity or incipient lethality of those chemicals, because they are chemicals. In little quantities, they are safe, but in larger quantities or when they accumulate, they become dangerous. The liver is the first point. From the liver, it goes to the kidney. Kidney is the other point of exit, and they can begin to destroy the tubules, your kidney tubules, and then you begin to have nephritis, you have chronic problems, and before you know it, you have kidney failures, you have liver failures. They come from ingestion of chemicals. And that's why when somebody has taken medicine work for him, you should not give it to another person, because you don't know that person's renal integrity of his renal function, or integrity of his hepatic function. You don't know. So it may have worked for you because your renal hepatic functions are well. But somebody has renal impairment, hepatic impairment, you poison the person further. It may lead to shutdown of the kidney or the liver. So the best thing is minimize the chemical intake. You know, take more natural things, natural products, because this system is designed by God to deal with natural things, organic things. You know, this is why we advise people not to go to illegal shops to buy medicines, because the person who is selling you the medicine, is the issue about selling medicine is not taking the drug and giving to you. That's not the work. That's not what pharmacists do. Pharmacists are a bridge between the medicine and you. Because if a man says take 1-2 times a day, it doesn't mean anything. Take one, what does it say? If you don't space the drug 8 hourly, 6 hourly, 12 hourly, or once a day, take with water, do not take with water. Take with food, do not take with food. Do not combine with any other medicine. People mix things and they drink and the thing just passes the stomach and comes out as waste because they form chelation. They've reacted, the chemicals have reacted and they can be absorbed by the bloodstream, in the bloodstream. But those people that call themselves chemists, or all kinds of names they call them, doctors, they wear lab coats sometimes to deceive you. They are merchants of death, because that's why everyone thinks selling drugs is the easiest thing to do. It is the most difficult thing to do. You must understand what product you're giving to somebody, what quantity you should take, the frequency of his take, and for how long, and what is his age, what is his height, what is his weight, biomass.
What is your take-home message to people out there who are watching you on how they should use their drugs? Because I see some people, you tell them to give 5 ml to their children. Some will tell you that they want to give 7.5 to make it work faster.
The moment you go outside the stated dose is misuse, and it can't be injurious. That 2.5 can become poison to the child, because it's been measured to know, when you do it, what they call pharmacodynamics, that the distribution of the drug in the system, your body mass and the integrity of your cell are taken into consideration. So if you overload the cell, it means that 100 cells that should be getting 1 meal, you are giving them 10 meals. So you're overloading it, twice the load. And therefore it can suppress so much, can kill the cell. And when the cell dies, the person dies.
Thank you so much for that wonderful lecture at no cost, all in an effort to save human lives. Please don't go away. We'll be right back after this break.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant information. The sorry state of our health infrastructure has also been a major challenge. On Health Affair, Oshomoa Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through quality information.
Now, we shall be taking you to our nutrition segment, where we preach the relevance of eating right to stay healthy. Today, the focus is on avocado pear and its health benefits. The avocado is a tree that originated from South Central Mexico, and it is classified as a member of the flowery plant family. The fruit of this plant, known as avocado pear or Persea americana, is botanically a large berry containing a single large seed. Avocado pears are commercially valuable and are cultivated in tropical and Mediterranean climates throughout the world. They have a green skin, fleshy body that may be pear-shaped, egg-shaped, or spherical. Commercially, avocado pears ripen after harvesting. Avocado trees are partially self-pollinating and are often propagated through grafting to maintain predictable fruit quality and quantity. Mexico is the world's largest producer, with close to 34% of the world's total production. A typical 100-gram serving of avocado pear contains 73 grams of water, 8.5 grams of carbohydrate, including 6.7 grams dietary fiber, total fat of 14.6 grams, including saturated, mono, and polysaturated fats, 2 grams of protein. It is also rich in vitamins A, B, C, E, and K. Avocado pear is rich in essential minerals like potassium, zinc, magnesium, manganese, phosphorus, iron, and calcium in appreciable quantity. Avocado oil has diverse uses for salads, for cooking, for cosmetics, and soap products. Avocado pear is a good fruit you can try out this season. Knowledge, they say, is power. The difference between a sick person and one who is healthy today is not connected with the information the latter was privileged to. So, on our clinic today, let's hear what the expert has to say.
People take their drugs with soft drinks. Some will put it inside eba and swallow. Yes, it may not affect some drugs, but most times we advise that you take drugs simply with water. But there are some that will make an allowance and ask you to take it maybe with something like milk or any beverage that doesn't have antioxidants in them. Antioxidants are things like fruit juices, and some of the soft drinks we may take may contain some of these antioxidants and may affect the drug that we're taking, particularly the anti-malaria, which we take, the artemether lumefantrines, the ACTs, as we call them by short. Most of them are affected when we take them with any drink or any food that is heavy laden with antioxidants. What they do is to neutralize the drugs, clean them off, and throw them out. So, drugs should be taken most times simply with water. But if there are times when you need to use other things to take them, always consult your pharmacist. Your pharmacist will be able to tell you, because since they understand the pharmacokinetics and dynamics of these drugs, they will be able to guide you better.
Our perception segment is where we make your opinion count to improve the nation's health sector and human lives. So be a part of this by dialing the numbers showing on your screen.
Cancer has been with us from time immemorial and will always be with us till we die. Cells of the body, any cells of the body that is capable of dividing is capable of forming cancer. The only part of the body that doesn't form cancer is the nails, the teeth, and the hair. They are already dead areas of the body. Detect them early. Be aware that cancer exists. And if any patient wants to keep away from the things that are common in forming cancer, like for instance, late nights, too much alcohol, smoking, things like this are bad.
The whole health system should play as one. The rivalry will only disturb the progress of the work. And we are not even well, we're not for it in this part of the world, because whether you're talking about the medical doctors or the other allied medical personnel, we have a great shortage of all this. And unless we cooperate, we're going to create more and more gap.
This is where we wrap up the show today. Thanks for spending your time with us. Please let's do it again same time next week, Wednesday at 9:30 a.m. I remain your host, Oshuomowa Daniels.